If you think back about these past 2 years, let's begin with the pandemic. COVID-19 has caused heartbreak all around the world. And I think we've seen images that most of our generations probably did not think were possible, and we are hoping not to see again. And I do have to touch on the past because I want to know, what do we learn from the past for the future? So why did this play out so badly? Why were we not better prepared?
First of all, it's a great pleasure to be here and share the stage with you. I have to say that there are a lot of things that we did extremely well. So we should not lose an eye of what science and human ingenuity was able to accomplish. It was a period of darkness that we thought that will take us years to get out of it. Though some miracles happened, miracles like the development of vaccines or treatments in months instead of years, and the ability of the industry to scale up manufacturing so that within few months, the entire world will have enough capacity. So these were things that I think work very well. Now, there were certainly things that didn't work as well as we would like to see. People were afraid, and fear is not a good advisor. And equity, it is easier to say than try to do. For the first months, for example, of the pandemic, the US was not allowing us to export anything outside the US, and I have to give that to Europe. The production that we were having in Europe, despite the fact that Europe was facing significant political pressures to get enough vaccine, Europe allowed us to export 50% of the manufacturing that was happening in Europe outside of Europe. US or India didn't allow anything to go out for months, for the first several months of the existence, and only after they covered their own needs, they allowed. That didn't work well. So I think that should be a lesson for the future.
Would you say that Europe showed a more human face
yes.
in this crisis?
Yes, I think so, more responsible face. The US, immediately after the end of the first several months, they jumped into the challenge, and they did also great things for humanity. Let's not forget that US bought 1 billion doses at cost of vaccines, so we didn't lose money, but we didn't make also money. But they bought it, and then they gave it for free to the entire world. So that was something that I think it was a nice thing for them to do. But nevertheless, the first 6 months, that were the first difficult months, Europe certainly treated the world way better. I need to be honest.
Yeah, well, thank you. That's why we're here all together. We want to have an honest discussion. This is something we heard again and again today. You know, we need to be open, and we need to talk about the tough issues if we want to move forward. What is your perception? What went wrong, and would we do better the next time? And I think there probably will be a next time. We don't know what it will be, but there will be.
So I want to share an optimistic perspective, yeah, and as Sigi Rosfram said, yeah, optimism is part of the definition of being an entrepreneur. But I think on the comment what we have learned, I think we have to make clear in societies, yeah, as much as we have, you know, the fire brigade, yeah, or we have the Technische Hilfswerk also, yeah, we have the military for difficult situations. That when it comes to pandemic preparedness, we need to know, we need to define who is in charge, yeah, and we don't really have that. So, and we cannot task the individual community hospital to be, hey, now be prepared. Yeah, while the incentive and the KPIs given to whether it's public or private is totally different. Yeah, so I think this is the big thing which needs to happen now. There are topics like the Center for Pandemic Preparedness, which is now founded in Berlin by the World Health Organization and so on. Maybe there are competing institutions, but I think this topic of who is in charge for the preparedness is a super important one. Yeah? So my opinion, but I think it's pretty logical. Second topic where I'm positive is and I want to echo this, you know, when it comes to understanding a new disease, not only understanding it, finding the right diagnosis, the diagnostic tools, finding a therapy, has been really done in record speed. And I think what we can learn for other diseases is that we have nationwide scoreboards. What is the infection rate? What is the vaccination rate? We monitor public health when it comes to COVID, and we know where are the gaps. We don't have the same in other pandemics which we got used to, like cancer or cardiovascular disease. We don't know who has the right treatment, who is informed, how do nations compare, and so on. So I think this aspect of how do we manage other diseases, which are as heartbreaking and even more prevalent, I think that is the learning of the positive developments which we need to have.
It sounds as if it would be a very complicated process of defining who will be in charge at the end, bringing interests from so many parts of the world together if we're talking about a global pandemic.
But I fully agree. Even at the country level, we found out that the health authorities, not everywhere, were equally good in addressing it. And the main characteristic is this, that although there are some renowned institutions, let's say the US, CDC, it is an institution that it is the standard of reference for the world when it comes to producing health policies in periods of peace. When it comes in periods of war, they lost, I think, their compass. And then there were multiple agencies that they thought that they can get engaged. In Germany, I think, it was way better, but still, because there are states, was not always being able to coordinate between the states to the degree that, for example, other countries that they were having more central power in terms of health authorities, they were able to do. So I think it's very important, and there's a lesson learned, that there needs to be some processes that when it comes to a pandemic, it is like if an emergency, that someone takes in charge. And this someone is already predefined. We don't discuss it during the pandemic. We know who will be.
So if you were to create a vision, who would it be? And how would the process be?
No, I think in every country, it is going to be a very different answer.
But the pandemic has shown us that, you know, no country can do it alone, and no country can master such a thing as COVID on its own. So, you know, how do we define a process that works for many people around the globe?
Yeah. I think should be in every country, there should be a predefined recipe who takes over. But then in the international community, there should be a set of standard rules that should be discussed and respected. For example, open trade. What happened during the pandemic, a lot of countries closed, as I discussed, the trades. That should not happen again, because if the countries that were producing raw materials for the production of this were also closing their borders, so that will be, no one would have anything right now. That's not the solution. We need to maintain that.
How vulnerable are we?
Sorry?
How vulnerable are we still with regards to scenarios that he just reminded us of, you know, closing borders or...
I think there is a lot of positive learning out of this. Yeah, as you said. I mean, but I believe what really needs to be the consensus is, on the one hand, there is the nation topic, which every nation needs to define what is the crisis mechanism. But on the other hand, there needs to be a set of global rules. Yeah, and one is not to close down, to share information, but also share, to not close down borders, for the importance of for important raw materials and so on and so on. And then I really believe that it's important to have one global institution, and in my opinion, it should be the World Health Organization, which is in charge of the knowledge exchange on that topic, including also the assessment of what level of crisis we have for which disease and to not have competing authorities. Yeah?
You've just mentioned war times. So how does the conflict in Ukraine play out for global health now?
I think there will be consequences. I think there will be indirect consequences outside Ukraine and Russia, that of course the ban and all of that will affect the health of the people. But the rest will be indirect. I don't think that the health will be affected directly because of the war, other than, as I said, those involved. But I think what could be, what I see is happening, it is that the war will take all the attention to that variable, which is for the right reasons, but then we may lose focus on the health. For example, we are here because of the B7 and because of the G7 will happen. Health needs to be maintained as a topic in the agenda, but it is extremely important to discuss. Clearly, Ukraine and the war will dominate the discussions, but should not take the entire air.
You know, what's happening during the crisis or the conflict in Ukraine now is that many countries are confronted with imported inflation. We see fuel prices rising, we see food prices rising. What impact could that have on global health?
I mean, as I said, it's an indirect effect, but of course the money, and we heard about the 3.2% or so of loss of GDP in Senegal, the money, as in this example, which is not there anymore, will have an impact on investments, which would be very necessary on health. On the other hand, I want to turn this topic a little bit around. What is the role of healthcare, of pharma and medtech in a global crisis? And I believe that there is a special aspect for companies like we manage or lead. We are truly global. We have employees in many countries, partially in countries which are at war with each other. We are excluded to a large extent, for very good reasons, from the sanctions. And I think that when it comes to keeping the world together, having global companies who have a totally unsuspicious mission of fostering health is a good basis to also work from, and I think a responsibility we have in this industry.
Yeah, because what you're touching on is what we saw also in this conflict, heartbreaking scenes. The pandemic is not over yet, and then a country is struck by war, and you don't have enough oxygen tanks for the people who are suffering from COVID and these things, and it just shows us how interconnected so many aspects are in today's world. But do you feel that, we've been talking a lot about supply chains. Do you feel that because of the current developments, supply chains need to be reorganized? And I'm thinking, how vulnerable are we in Europe, for example, with medication production, for example, in India or in China?
I mean, when it comes to medication, it's better when Albert answers.
Yeah, but I would like to have both of your perspectives.
So I know my limits. I think what we need to bear in mind, I mean, and I give examples of our business. When it comes to certain supercritical, super important medical equipment, whether it's cath labs or MRI scanners or CT scanners or linear accelerators in radiation oncology. These are small, serious production businesses. We are global market leader by producing 1,000 to 3,000 of them per year, of each of these categories. That means it is completely unsustainable to believe that each country can do this by themselves. We need, so to say, and it comes to scaling the new, we need the world market to recover the investment in R&D and to keep a production. You don't develop and a business to then sell 50 of these units. Yeah, so a nationalization of a supply chain is, in this business, complete economic nonsense. Is it better, of course, yeah? And are we also working on being less dependent, yeah, on single source situations, be it other companies or be it certain geographies? Yes. But a complete nationalization will simply not work and would be a big negative on innovation in healthcare and would basically make healthcare much less affordable than it is today.
What is Pfizer's strategic approach when it comes to supply chains and bringing in geopolitics and geoeconomics more into the company's strategy?
First of all, we believe in globalization, and we believe that supply chains should maintain open, and that's the best way to operate. But the realities are hitting. For example, there was a reason why, together with our partner, BioNTech, because Pfizer in the vaccine, we did everything with BioNTech, the best partner we could ever dream, and we wouldn't be here if it wasn't for the partnership of the two of us. We knew that it is very sensitive, so we decided to do two separate supply chains, one in the US and one in Europe, so that we will be able to provide, let's say, independence. The same is with everything we do right now. We have quite good independence from, let's say, places like China or India in terms of drug substances, because we know that those two countries are higher risk if something happens to close their borders. China, there is a lot of tension, so there always could be an opportunity to retaliate for something. And India was the country that did that with COVID. Actually, they blocked the entire world by shutting down completely. And there is, in medicines in general, a dependency from those two countries in terms of raw materials. So I know that there is a lot of deliberations in EU level, for example, and I know in the German government as well, how some of this independence can be also achieved. So just in case you will not be dependent on raw materials that are not made in friendly country soil, let's say.
So let me ask you the same question I asked the CEO of Scheffler earlier. How much flexibility do you have within your supply chain to just substitute the raw materials you need, and where do you find them?
If you are asking about COVID, full flexibility. Actually, part of the agreements with the EU was, when we did the very big agreement to supply doses to the EU, was that we need to ensure that all production and all raw material production is happening in European soil. So we built all the infrastructure from scratch when it wasn't existing, so that we have full independence. And in addition to that, we have in the US an additional channel, so if something goes wrong, and of course we have a network of suppliers. So when it comes to COVID, we have full independence, particularly in the EU. Also, don't forget, the treatment is produced in Germany for the world, right? So, but when it comes to other medicines, clearly there are interdependencies from one country to another.
Let me ask you, because we're also talking about, access, global access to healthcare. You have started an initiative in Davos that was actually mentioned and taken public, the Accord for a Healthier World. What exactly is your vision, and what are you trying to achieve, and who is supporting you?
Yeah. 2019, we set a goal with our leadership team that we will reduce by year 2023 by 50% the population in the world that they cannot afford our medicines. And what we did in Davos 3 weeks ago, we announced that we will offer all our patent-protected medicines, all medicines or vaccines, at cost, and we define cost to manufacture and to send. We are not loading this cost with administrative or research or legal expenses, to 1.2 billion people living in the 45 poorest countries of the world. How the countries were selected, it's all 27 countries that they are in the low-income category of the World Bank, plus 18 countries that graduated from the low income in the last 10 years, and they went to higher income. So for them, we are going to give it all the medicines at cost. Now, we know from pandemic that that will not be enough. I'm afraid those medicines, we are speaking about breast cancer medicines, for example, the most prescribed breast cancer medicine in the Western world. They don't diagnose breast cancer in Africa, unfortunately, to the degree that they could. So the same happened with the vaccine. The vaccines are right now available, hundreds of millions of doses, available not at cost, free. European Union is trying to donate doses. The America is trying to donate doses. They cannot find recipients because they are lacking basic infrastructure to set a tent and the vaccination campaign. It's something that is given in our countries, over there is not. So that's why, as part of the accord, we selected 5 countries. Actually, Senegal, the minister was here, is one of them. Rwanda is the other one, Uganda, Malawi, and Ghana. That we will work with them to try to understand what would it take to develop their system so that they can utilize those medicines and then learn from that for the remaining of the world.
So that brings me...
Thank you.
Brings me back to the quote from the B7 summit, business is not in business just for business any longer. We need a more holistic approach. As a journalist, I'm asking you, would you be willing to share the amount of profit you were not considering because of this action?
This is what we did.
Yeah, but you know, you're not doing it for profit. So let's put it this way. How much money are you basically donating?
Right now, I'm afraid very little because they will not take the products. And in all essence, in all honesty, I don't think that we could even sell the products. We have over there a market that is only private. So it's a small only for the affluents. This market we will lose. But in the overall scheme of Pfizer, it's a very small cost for us to pay. Where, if we want to be, if we want to measure the success of that, not with the announcement, but if we reduce mortality, for example, in Senegal, we need to make sure that these products are used, and for that we will need money. I don't think alone a company like us can upgrade the healthcare system of 45 countries. But if we work together with WHO, and if we work together with other institutions, with the Gates Foundation, and with Doctors Without Borders, and everyone who has goodwill to create an infrastructure there, we can change everything. That will require money, and we are willing to pay that money.
So since we're having an honest discussion, you know, I do want to take in a different perspective, and I know you probably won't like this perspective, but I do want to hear your take on it.
The story of my life. Go ahead.
Yeah, I can imagine. There are some critics who say you will be acting as a gatekeeper by doing this. What do you tell those critics?
Explain me, gatekeeper?
Yeah, as a gatekeeper to the markets that you are doing this with.
I don't understand the concept.
That you will basically enhance your position on the market and decide what will happen there.
No, I think we are giving our products at cost if they want them and if their physicians prescribe them. What I'm afraid it is that those are the same products that are used in Germany, in France, in America, in Japan, and they are not used there for a reason, because they cannot afford them. And now we are taking away the equation that they cannot afford them. I'm afraid that once you take out the spotlight from they cannot afford it, another area will appear that they don't have the infrastructure to use them, because no one will diagnose a heart condition so that they can give the best medicines that it is available right now. And I think that will move the spotlight to the real problems of health inequity, which right now is creating very different measures for them.
Absolutely, and we're excited to see where this accord takes you and how it will play out in those countries. Coming back to the issue, access to global health and economic prosperity, what role is geopolitics and geoeconomics playing right now for global healthcare access, and how important is global healthcare for economic prosperity?
So, as one philosophical comment, I believe economic prosperity is important for healthcare. Yeah. So, I mean, to some extent, I mean, healthcare is a super important economic factor. Yeah, I mean, it is sometimes, you know, when we have the cost debate about, oh, it's 10% of GDP, or in the US 18% or so, it also shows it is, wow, it is 10% of GDP, or maybe in Germany 7 or 8. Yeah, so it is a huge economic factor. But my initial comment is just, let's don't switch things around. Healthcare is a super important, being healthy is a super important value, and maybe sometimes more important than being rich. Yeah? So from that point of view,
privilege.
We should not forget that. Yeah, but I also believe, yeah, and this is now from a TDI perspective, what we as from a German point of view should not forget is how important the healthcare industry is and can be in this country. Yeah, so as far as I know, the so-called industrielle Gesundheitswirtschaft, yeah, so the industrial part of healthcare, which is not the providers, not the hospitals and so on, is 800,000 jobs. Yeah, so this compares quite well with the automotive industry and so on and so on. And I think it is a very future-oriented industry. It fits very, very well to the country, to the skills of the country. There's not much dependence on raw material and so on and so on. It fits to our strength. And and I think it is important that we have that on the agenda also when we think about what is the path Germany is on. Yeah, sorry for that national commercial break. Yeah, but I also believe, yeah, that when it comes to the global aspect of global collaboration, healthcare and the medtech and the pharma industries can really be beacons of leading the way.
Unfortunately, we don't have much time left, but as you touched on the future, I would like to take a look into the future with you and into new technologies and their role for global healthcare and global access to healthcare. What role could the Metaverse, for example, play when it comes to equitable global healthcare?
It's a paramount role. I think right now, when it comes to medical innovation, I truly believe we are about to live a scientific renaissance. We are going to see solutions to medical problems that for decades science was trying to find and they couldn't. The reason is not only advancements in biology, but even more important, advancements also in technology. And those two together, AI, for example, are creating synergistic effects that will give us solutions that will help not only the health, but also the economic life of this country.
So I can't let both of you go, as the pandemic is still a huge issue for us, to get your perspective on how it will continue to play out. Last question, the COVID pandemic. How will it play out, health-wise and economically?
How?
Health-wise and economically, how will it develop?
I think, I mean, health-wise, I mean, we've seen the worst, yeah, and I think we have seen the learnings, and I think we can now say, yeah, that we are beginning to see a world which benefits from having lived through this crisis. Yeah, I'm not saying we are there yet, but I think we are beginning to see this world.
I think people are asking if the virus will disappear. It is extremely unlikely. The virus will be with us for many years. Mm-hmm. However, the right question it is if the pandemic, not if the pandemic is over, but if we can get our lives back. I think we can. Mm. I think we have right now medical solutions, vaccines, treatments, other, that even without having social distancing measures, mm-hmm. we can live our lives going forward. But we should not relax, mm-hmm. because what we see right now will be constant waves, and some of them could be more virulent than some others. So we should maintain very sharp focus on what needs to be done if a wave like that is happening.
We should not be too complacent.
Not at all.
Thank you very much. Dr. Albert Bourla, CEO of Pfizer, and Dr. Bernd Montag, CEO of Siemens Healthineers. Thank you very much.